As Patrick so eloquently announced, my name's Jawad. I had a grand entrance plan, but Cornwall stole my thunder. Okay, I'm an IM&T project manager, and I work with South West London St George's Mental Health Trust, and we've got a project on the way which we've called Mobile Technology. Okay, the trust profile. We're a mental health trust, and we work across 5 London boroughs. We deal with the tertiary and specialist mental health services within our UK catchment area, where you have 750 inpatient beds and hostel placements, and approximately 1,000 of our 2,500 staff are clinical, and they're community-based. Okay, the electronic care records. In 2006 and 2007, we implemented our electronic care record, which was RIO. This allowed us to achieve a paper-like working environment. What we quickly realised once RIO was totally embedded was that because now RIO was the de facto way of recording clinic information, staff would come back to the office space and they weren't leaving until 1, 2 in the morning sometimes, people have said. And this was simply so they could keep up to date with the clinical note. So we realised very quickly that we needed a way to allow them to have access to RIO out in the community with them so they didn't have to suffer from having to come back to the office all the time. In December 2007, the Trust Board approved a business case for 1,000 devices. And it included the evaluation phase. The milestone was we deployed 300 devices. That was our milestone. And if after 300 devices, we did an evaluation. If the evaluation was successful, then we'd be allowed to continue with the rollout. This presentation is based on that evaluation, the 300 devices that were out there. The devices were Fujitsu tablets, which we got from Tracline. Thank you, Tracline. Okay, very briefly about the project. We ran it under full Prince 2 methodology. It was chaired by the medical director. The evaluation stage was after 200 devices. And as I said, the evaluation determined whether we continued with the project or not. Okay, from the outset of the project, we had clinicians involved. What we saw this project as, not as technology for technology's sake, what we saw this project as, it was trying to provide a tool for the clinicians to work and enhance their clinical practice. So what we did, we got clinicians involved from the outset. Before we even gave it out full scale, we got clinicians involved and they tested the technology for us. We tested it ourselves, but we wanted them to test it in the environment so that we knew it worked for them as opposed to, we knew it worked as a technology, but we wanted to make sure it worked for them. The clinicians gave us feedback and they also spoke to other clinicians about whether or not it would be feasible to go ahead with this type of project. Okay, there was a massive change management element of this. Understandably, clinicians were now going to be using technology instead of pieces of paper when they're out and about. So we had a massive change management program. We visited all teams prior to the rollout. We engaged with senior management to solve benefits. We also provided hands-on training. And we have a very proactive IM&T service desk who are well versed now with all the issues that come about as a result of being mobile. And we also had a remote working policy drawn up. Okay, the project objectives and benefits. One was to enable RIO to be used as a real-time system in the community, and 2 was to improve clinical care by providing access to up-to-date information. Okay, these are the benefits we sought out to achieve, and these are the benefits that we did actually achieve. We did realise a raised standard in care. We did improve patient experience. We did improve the work-life balance of our staff. We increased efficiency and productivity. And we have reduced estates overhead. Okay, this is the boring bit. I'll go through it. Well, we're in a technology conference, so it's not boring, is it? Okay, this is what we have, the technology. Okay, this evaluation was based on tablet PCs. After the evaluation, we got a lot of feedback from the users, and we then went back out and did another refresh of our technology, and we've come back with a different device. But the devices that were based on this evaluation were tablet PCs. We use 3G external modems from Vodafone. We use VPN, and the VPN, we also have authentication tokens. We're using encryption software and also compression software. And the access that the user are able to get is RIO, the emails, the internet and intranet, and their shared folders. So whatever they have in front of their PCs, they're able to get with them whilst in the community. Very quickly, the way it works is that they get a connection to a 3G network, and we're in London, which is fantastic. It means that we have very few black spots. So they get a 3G connection, then they hit the VPN, they go into our trust services, and then they can go back out into Rio. So everything's done localized within our trust. Okay, the evaluation. I sent out a questionnaire to 120 users, and I asked them questions, and I also asked for some comments. Out of the 120 users questionnaires I sent out, I got 87.5% return rate, which is pretty good apparently. As well as sending out questionnaires, we also did a thorough analysis of the data on Rio. So we did both qualitative and quantitative analysis. Okay, these are questions from the questionnaire, and these are the results. The first question I asked was, how useful have you found the device? As you can see, overwhelmingly, most people said they found it very useful. The next question I asked was, how easy have you found the device to use? The tablet PCs, most of you probably know by now, you've got the ability to write on them. What we did when we were doing our testing, we realized with the tablet PCs, you could write directly into Rio. So in our clinical tool, you could write directly into it. You could tick all the boxes, click on all the radio buttons, click onto a calendar, put in your entries, etc., etc. So it was a very, very powerful tool. So we asked the users, how easy have you found the device to use? Most people said very easy. Some said quite easy. Again, it was learning new technology. Okay, this is what one of the clinicians says. It enables me to spend more time with the clients as I am not worrying so much about getting back to the office to complete notes. The next question we asked was, have you used the device with the client present? Most people said no. Remember, we're a mental health trust, so the nature of our clients are slightly different to those in the acute sector. Of those people, okay, this is what the clinicians are saying. I can also work on a care plan with the client, which makes care planning a joint effort more than ever before. Okay, so we asked those users who had used the device with the client what the perception of the client was. As you can see, overwhelmingly, the perception of the client was very, very positive. Oops. Okay, this is now what the clients are actually saying. It's good to access information that is required without having to wait. The client was impressed and happy. Both her and her parents were very impressed. Okay. Ask the question, did the device reduce your need to travel back to the office? Again, overwhelmingly, people said yes. Remember, we're a 5-borough-based organisation. We have 98 plus sites that we work out of. I mean, it's catchment area, so you have people who work in Wandsworth. But even within Wandsworth, for example, it's a massive geography. Okay, this is what clinicians are saying. Can complete notes during working day without having to be at a clinic office space. This means I can organise my day more effectively. The next question I asked was, do you feel the device has made you more productive? As you can see, overwhelmingly, most people said it has. Okay, this is one of those questions that can be very, very, very objective, and you can put a lot of bias on this. So it was around this question that we did a lot of quantitative research. Okay, this is what clients are saying. I'll quickly read that. When clients aren't in for home visits, or visits do not last as long as you anticipated, you get work done between appointments. Okay, oops, let's go back. Okay, what we measured in terms of actual data that people have been putting into Rio was the number of appointments per week. We wanted to test whether or not they were seeing whether or not they were putting in more appointments. And two, we were looking at the use of Rio. Now that you had Rio mobily, you didn't have to keep coming back to the office space. We wanted to test how people were using Rio, whether they're using it more, whether they're using it as it should be used, etc., etc. Okay, now these are the results. As you can see, as soon as the devices were issued, people were either seeing more contacts per week or were actually recording the fact that they were seeing contacts. Either way we look at it, it's a good thing, because once we go down the practice-based commissioning route, where you only pay for what you record, the fact now people are actually outcoming appointments means that we are going to get paid our trust. We did a statistic. This works out to be a 33% increase in productivity. And for me, the amazing thing is that when we did this initial rollout, we didn't sit down with the client or with the clinician and say, this is what you can do with the devices. And, it was my mistake. We have been doing that now. But what we told them is that you've got this and you've got the ability to use Rio any way you like. So as a result of their own back, they actually were able to increase their productivity just because they actually saw the benefits of what they were using. Okay, this is the actual Rio usage. As you can see, again, as soon as they received the devices, now that they were able to go into Rio anytime, anywhere, the Rio was increased significantly, usage. We did a test. This is both putting in data and getting data back out again. Rio being a clinical tool obviously means you've got live patient data in there, and because it's always being updated by clinicians, it means that you always have access to the most up-to-date information in front of you. Clinicians have said this is a phenomenal tool now. The fact that they got access to Rio is amazing, because traditionally what they used to do, if they needed any information on the patients, they had to call back to the team base, hoping an administrator was there, and they're getting the administrator to log in, search for the details, and more, sometimes they got it wrong because you're asking a third party to get the information for you. Now, whenever they need information, all they do is log in and they can get it for themselves. And they say it's saved them hours. Because half the time they were just on the phone waiting for information from a client, for a client rather. Okay, the next question we asked was, has this device improved your work-life balance? Most people said quite a lot. There's many caveats around that. One of them is control and balance. What people were doing was going home and sort of like logging in at home and then working from home till God knows what time. What we have told the clinicians is that yes, it gives you the ability to work at any time, anywhere, but you've really got to be disciplined. And what we have a process which a lot of clinicians now follow. What we tell them is that once you're out, if from home, you can go straight to your first appointment. After your first appointment, either with a client or thereafter, you can enter your notes for that particular patient. If you follow that trend throughout the day, by the time you get to see your last patient, all the notes have been completed for all your patients for that day, so you have the one to do. Somebody actually said to me that it's for the first time since RIA was implemented, she was able to leave work on her contracted hours because she was able to have RIA with her at all times. It meant that she could actually log in and keep up to date with her work. I mean, she told me that the latest she left work was 1 o'clock because she was just trying to keep up to date with all these notes in Rio. Okay, this is what they've been saying, staff have been saying. Once I felt confident the device will work, I was quite happy to leave work on time and be home to tend to family needs. Yes, greatly, now leave work on time. Less stressed out as workload more manageable. Also been saying, enable me to work from home on a few occasions, which is a good break for me and saves a 2-hour commute on a daily basis. Definitely, it helps me to create more flexible time with my family. And this is what most people have been saying, so this whole thing about flexibility. I mean, because you can do things as and when, people are now able to be a lot more comfortable in. Again, it's up to the manager's discretion. We've got a number of policies, local policies from a manager's viewpoint. Things like if there are carer needs, the staff member, again, with manager's permission, can stay at home and look after the carer's needs because they've got the trust infrastructure with them wherever they are, so they can catch up with work, they can keep up with emails, etc., etc. Okay, ask the question, have you experienced technical difficulties whilst using the device? Most people said sometimes. The main reason for that sometimes was connectivity. Even though we're in London, there were issues. One of the biggest issues was we were using external dongles for our connection, and the reception on that wasn't fantastic. So what we've done subsequently, we've got a new device that has the modem inbuilt into the device. And when we did the new refresh of technology, we did side-by-side tests, and 10 times out of 1, the new technology works a lot better. We never got a bad signal. We went to places where people reported really bad signals, and when we did a side-by-side test, the new technology worked. We never got a bad signal. When I then, in the new contingent of users, I've asked this question again, and I don't think there's any sometimes. It's mostly none now. There's a few reallys, but mostly people saying they haven't experienced any difficulties now. Okay, and conclusions. Okay, the evaluation. So remember, this was of the first contingent of devices. It did prove to have enhanced clinical effectiveness. It did reduce travel time. It improved work-life balance, increased productivity, and the technology was easy to use. Also, it enabled 30% reduction in office accommodation. We have a new build on our site called the Wanderers Recovery Centre, and it's a big ugly building, and it was built on the